Hello everyone, yes, this is Damon and I'm standing in my kitchen in my scrubs and a little bit nervous. But I want to talk to my professional nursing colleagues and perhaps even some future nurses out there about the Institute of Medicine and the Robert Wood Johnson Foundation's national study to strengthen nursing. They call it the future of nursing, and it recommends that 80% of registered nurses be prepared at the baccalaureate level by 2020. Did you know that Gallup completes a poll every year, kind of close to the end of the year, and since 1999, that's the first year that nursing was included in the poll, we have ranked #1 for honesty and ethics, except for 2001, and as everybody knows, 2001 was 9/11, and the firemen actually won it that year. Also, did you know that 84% of medical errors are intercepted by professional nurses? And as nursing education increases, negative patient outcomes decrease, specifically failure to rescue. We all know as professional nurses we have a duty to lifelong learning, and especially now with advances of technology, our patients are living longer and they're having more complicated multi-system issues. The industry's changing. We know we're dealing with billing issues, fraud issues, ethical dilemmas for nurses. And of course the Board of Nurse Examiners tells us that we're going to complete 20 CEUs biannually for licensure renewal. And yes, for the haters out there, I am not just a graduate student preaching my sermon. As many of you know, I entered the profession of nursing at an ADN level, and once I went to the bachelor's level, I found that for me personally, working on my BSN was actually easier than nursing school. And part of the reason why I think that to be true is as a professional nurse, we have all kinds of resources and all kinds of contacts that are at our fingertips. There are several different types of BSN journeys. There's a brick and mortar university, a distance learning, or a combination. So I want to challenge you to join the campaign. The campaign is known as 80-20 and 2020. In other words, 80% of the registered nurses will hold a baccalaureate by 2020. So complete your BSN by 2020. And if you have a BSN or an MSN, advance your educational level one more level. Some final thoughts I want to leave you with. Someone I admire really well, really closely, I consider her a true professional nurse, recently told me she's an ADN prepared, and she said to me, to be quite honest, I'm embarrassed that I don't have a BSN considering the position that I hold. And another individual told me last week, you don't know what you don't know. So in closing, I'd like you to click on the video that you like it, or put in the comments that you would pledge to complete your BSN by 2020. And if you don't want to, say, I'm not interested in this campaign. And thank everyone for your time.